Good afternoon. Welcome to the Baylor Scott and White Health Complete Pregnancy Guide live Q&A. We're going to start in just a minute. Welcome to Baylor Scott and White Health's Complete Pregnancy Guide live Q&A. I'm Casey Prince, the Director of Marketing for the East Region, and I'm excited to lead a conversation today that will give us a 360-degree view of all aspects of pregnancy, including mental health, physical health, fitness, and nutrition. We know that delivering better means taking care of your whole self. So we're going to start today with a quick poll to see where you're at in your pregnancy process. If everyone can respond, we'd love to see where you're at in your pregnancy journey. All right, let's see the results of the poll, where everybody landed. Okay. All right, it looks like we've got the majority of people here who are currently pregnant and then thinking about pregnancy, and some that recently gave birth. So we've got a good variety of people here, so that's fantastic. Thank you everybody for participating in the poll. So we're going to move on now to many of the questions that y'all submitted. Y'all submitted some great questions when you're registering, and we're going to spend the majority of our time today answering those questions that you sent us. But if you think of a question you'd like to ask us that you didn't already submit, you can submit that via the chat that you see here, and we'll try to answer as many of those as we can. But first, I want to introduce all of our panelists and specialists today. First, we have Paula McKenzie, and she's a physical therapist with Baylor Scott and White Rehabilitation Center. She specializes in pelvic floor therapy, which has proven helpful to women during, after, and preparing for pregnancy. Paula, tell us why you chose this career path.
Hello, welcome everybody. I became a physical therapist originally because I have scoliosis, and so I did some physical therapy when I was an adolescent, and it intrigued me in the profession. And then because of my scoliosis during my own pregnancy, I had a lot of back pain. And so I got really intrigued on helping pregnant clients through my own journey. And so I got interested in treating initially pregnant women, but then from that it spiraled into the whole world of pelvic floor therapy, women's health issues, and even some men's health issues as well. And so I've really just enjoyed working with and getting to know my pregnant clients, my postpartum women, and all the patients that I've served.
Wonderful. Thanks for joining us today, Paula. Next, we have Dr. Kenley McMinn. She's a licensed clinical psychologist specializing in women's health and trauma on the medical staff at Baylor Scott and White University Medical Center, Dallas, with an emphasis on helping women with addressing the issues that are unique to their experiences as women. Dr. McMinn, what is your favorite part of your job?
I would say the favorite part of my job is just getting to know all of the unique individuals that I get to work with. I get to talk to so many people and hear so many different stories and make really amazing connections. And being able to just be a part of people's journey as they make progress in their lives. It's really rewarding.
Wonderful. Thanks, Dr. McMinn. Also joining us is Dr. Gabriella Zandamini, OBGYN on the medical staff at Baylor Scott and White Medical Center, Lake Point. Dr. Zandamini, tell us what you love about your job.
Hi, good afternoon, everybody. So I also really like, I think everybody that's gotten into healthcare likes to connect with people, and so I really enjoy that and kind of meeting people and building a relationship with them, and then being a part of one of the most important times in their lives, which is having a baby. So it's really a privilege to be able to do that. So.
That's great. Thank you, Dr. Zandamini. Next, we have JC Slocum, the lead outpatient dietitian and diabetes educator for Aramark at Baylor Scott and White All Saints Medical Center, Fort Worth. She has dedicated the past 5 years to counseling pregnant and postpartum women. JC, how has your personal journey led you to this career path?
Hi, everyone. So nutrition has always been a passion of mine. When I was 12 years old, I was diagnosed with celiac and Crohn's disease. I was just really sick and battling some major issues for about 6 months before I finally got that diagnosis. And to be told that you can no longer have pizza and cookies and cakes and things as a 12-year-old rocked my world, to say the least. And so I had to navigate how to better manage my diet, how to make adjustments to significantly feel better. I saw changes in energy levels and just overall academics, sports, things like that. And just over time, it's really grown to a passion and being able to help other people navigate through their own health and nutrition. And so it's definitely kind of led me down this career path, which I've been very blessed with.
That's a great story. Finally, please welcome Dr. Kathy Holt, OBGYN on the medical staff at Baylor Scott and White Medical Center, Frisco. Dr. Holt, tell us what you love about your job.
Hi and welcome. I would second everyone's previous comments that I think all of us love taking care of women. We all love taking care of families and getting to meet people and walking them through this journey that can be exciting and anxiety ridden, but very, very rewarding always in the end.
Great, thanks for being here. Now we're ready to answer your questions. So we'll start by answering the questions we received from registrants when they signed up, but please again, use the chat function if you have a question you'd like us to answer, and we'll get to as many as we can. The first question is for Dr. Zandamini. How can I set myself up for the best labor and delivery experience and for smooth recovery once the baby is here?
So I think 3 main things will help. Not the most, but things that I usually recommend to my patients. One is exercise, and trying to exercise during the pregnancy. I know it's hard. I've been there. You are tired, the last thing you want to do. But even if it's just 20, 30 minutes a day of just walking makes a huge difference of just how your body feels during the delivery, how you recuperate afterwards. So as long as it's a low-risk pregnancy, definitely exercise. The second thing that I think makes a huge difference is to have a good relationship with your OB. Have conversations with your prenatal care. That's why you're seeing them 8 to sometimes 13 times throughout the entire pregnancy. Talk to them, see what your concerns are. Have that relationship so that if anything happens, you know that you can trust them to do what you think you want or what you want. And then the last thing is to have a postpartum plan. I mean, we always talk about the birth and the birth and the birth, but really sometimes the hardest part is after the baby comes, because you're not sleeping and you don't have time. And so having meals in the freezer that you can just take out and have something to eat really quick, or have people that can come over, not to just meet the baby, but to help. And so that people that can make a meal, that can put a load of laundry, that can do things, and that they don't come all together because everybody wants to come immediately after the baby comes. And sometimes to see if you can kind of like stack them so that you have help for that first month. So those are 3 things that I think help a lot.
Very helpful, thank you. JC, this question's for you. Am I really eating for 2 during pregnancy?
So the short answer is no, we're not eating for 2 during pregnancy. However, during pregnancy, our nutritional needs do increase. And typically in that first trimester, I tell people survival mode. During that first trimester, we are sick, we are exhausted, we're a little, shaken up with the fact that either we're super excited that we just found out we're pregnant after getting so many negative pregnancy tests or for the process, or we're just a little terrified with what's about to happen to our bodies. And so that first trimester, really, we want to make sure we're getting a balanced diet, stay hydrated. As far as energy needs go, it doesn't really change. Second trimester, increase it by about 300 extra calories, and third trimester by 450 extra calories. And so think about what your typical eating habits look like. Do you typically eat 3 meals a day, or do we normally skip breakfast or lunch? And so kind of just start there. So if you typically skip breakfast, then 300, 450 extra calories could be as simple as having a cup of oatmeal. Maybe we add a handful of walnuts to it for extra omega-3, add in your favorite fruits like berries, strawberries, banana slices for some extra fiber, and then have some extra protein on the side. Maybe we have a couple of scrambled eggs, or even add a little bit of a nut butter to your oatmeal. If you're already eating 3 meals a day, then consider adding an extra snack. And so anytime you have snacks, don't think about the crunchy, the salty, or the super sweet. Think about extra fiber, extra protein. That's really going to help your body to get what it needs to help getting you through a healthy pregnancy, but also to keep your energy levels up. And so I was thinking about pairing things together. So cheese and crackers, peanut butter and banana, Greek yogurt with some fruit with it, and so little things like that.
Thank you. Dr. McMinn, is it safe to take antidepressants while pregnant or breastfeeding?
The number one thing I would say is that it's different from person to person. So my number one recommendation is always just to make sure that you're talking to your OBGYN about that, or to your mental health provider, your primary care, whoever it is that might be prescribing that. That said, there have been a number of studies that have been done that have shown that there are certain antidepressants that can be safe to take during pregnancy and in the postpartum period. We want to balance sort of the risk to benefit ratio with that, especially if it's somebody who you've already been taking a medication for a while when you become pregnant. We want to sort of figure out, there can be risks with coming off of a medication if it's something that's been sustained in your system and it's been helping your mood. So the number one thing is talk to your doctor about it, but there are some safe options.
Thank you very much. All right, Dr. Holt, I'm having trouble sleeping during pregnancy. Do you have recommendations for a comfortable sleep position or other remedies to help?
Sure. This is a common question just because pregnancy becomes so uncomfortable sometimes in the 3rd trimester. But the textbook answer is ideally you're supposed to sleep on your left-hand side. That just increases your body's ability to give oxygen and nutrients to your developing baby, especially in your 2nd and 3rd trimester whenever your stomach is larger. But I usually tell my patients you can sleep in whatever position that makes you comfortable, because in the end it is about comfort. I think a common myth is that you can't sleep on your back. And I tell people when I examine you, you're on your back. So you actually can lay on your back as long as you're at an incline and that you are comfortably breathing, then that's going to be sufficient and a good position for you, both you and baby. During labor, we switch you from different positions, left and right and back. And so any position that allows you just to be comfortable is okay. I joke with my patients sometimes and I tell people you can't sleep on your belly. In your 2nd and 3rd trimester, Mother Nature makes that impossible anyway. No belly sleeping, but sides, left side is always best, but you can always rotate just for your comfort level. On the market, there's always, pregnancy pillows and bolsters and things like that to try to keep a woman in a comfortable position during pregnancy. And so a lot of women utilize those pillows and things like that as well.
Thank you. Paula, what is the best position to labor in? Are there other options besides laboring on my back?
Yes, there are definitely other options. I also caution people to say that there's only one right position. There are a lot of different positions, and different circumstances may make one position better for you versus another. But if you are in a squatting position, and Baylor has birthing bars for their beds, Baylor Scott and White's labor beds, and so you can support yourself with a birthing bar, get into a deep squat, and that helps to enlist gravity, which can help with the pushing process. And then also gravity, of course, will help bring the baby out. That's not always comfortable for everybody. Sometimes you're more comfortable if you are on your hands and knees. Again, that helps enlist gravity. Your partner can then maybe do some massage to your back if you're having back labor. Same thing as if you're over a birthing ball. Again, you're supported, but again, allowing gravity to open up the pelvis, get into a better position that way. Laying on your side sometimes also can allow your partner to massage your back, get into a better position there, and take some of that pressure off the back wall of the pelvic floor muscles. Sometimes you have to labor on your back. Maybe you have an epidural and you just don't have enough, it's a strong enough epidural that you don't have enough control to support yourself in any other position. And if you have to labor on your back for any particular reason, one of my best recommendations to people is to put a pillow underneath your pelvis so that your sacrum can move out of the way, and then those pelvic floor muscles can stretch a little bit more than if your sacrum is pinned on the table and then you're on your back and all the weight of the baby's head is towards the back wall of the pelvis.
Thanks for that information. Dr. McMinn, are there complications to having postpartum depression after having a second baby within the first year of giving birth to your first child?
I would say this is another situation where it depends because everybody's journey and experience is so different. There have been studies that have shown that there is a slightly increased risk of postpartum depression, postpartum anxiety, the closer together a person has babies, so especially if it's within the first year. This has to do with sort of the added hormone cascade that happens with being already kind of probably stressed and exhausted from having the first child. So having two within a short period of time, it is an increased risk, but that's certainly not a guarantee. So what I always recommend is that if that's the situation that you find yourself in, that's probably something that you would want to just monitor very closely with your OBGYN, just to keep an eye on mood, keep an eye on anxiety, and then it can be addressed as it goes along.
Thank you. Dr. Zandamini, how long after birth should you take prenatal vitamins for if you're planning to breastfeed?
You should continue to take prenatal vitamins the entire time that you breastfeed. That being said, a prenatal vitamin is a good vitamin for any woman to take. It has all the nutrients and, well, all the vitamins that anybody would require. So definitely when you're breastfeeding, because you might have more requirements because you're giving more to the actual baby, but even afterwards, before the next pregnancy, you can continue to take it the entire time.
Great, thank you. JC, what nutrition do you recommend to help with recovery after delivery?
Yeah, so when it comes to delivery, I think we kind of talked about it earlier, but you go from the questions of everyone's asking you, how are you feeling, how are you doing, mom, during pregnancy, to you deliver this baby, and all the attention goes to baby, even our own attention. And so the very first thing we do is we forget to feed ourselves. We deliver this baby, all of our attention goes there. We are living in this 2 to 3 hour window for the next month because of how often baby is feeding and sleeping and things like that. And so remember that food is fuel. The purpose of food is to provide our body with the nutrients that we need to function correctly. And so try your best to get back to getting a variety of your fiber type foods, so foods from fruits and vegetables and whole grains. Your lean proteins like the chicken, the fish, lean ground beef, turkey, even your plant-based proteins in that sense. And then also make sure you're staying really hydrated. So my 3 big tips for any new mom is set a timer, remind yourself to actually eat, because if you're like me and you get really busy and overwhelmed, you just forget to eat. And so set the timer, remind yourself to get something on your stomach. If you are if you're nursing, if you're bottle feeding, however you're choosing to feed your baby, keep a beverage with you, keep a snack with you during those times, because the feedings take a while. They take 30 minutes up to even longer sometimes. And so that's valuable time that you can kind of munch on something. Make sure you're getting a balanced diet when you are eating. After we deliver a baby, either through natural deliveries, through C-sections, whatever it may be, you're on medications that can lead to constipation. And so get plenty of fiber. Make sure you're adding the fruits and vegetables. I always tell my patients to utilize what's called the plate method. And so the idea is that half your plates should be covered in your vegetables, your fruit, a quarter protein, a quarter carbohydrates, like your potato, rice, pastas, things like that. That will ensure that you're getting a good variety. And then the last thing I tell my patients, drink plenty of water, stay hydrated. If you are choosing to use formula or if you're choosing to breastfeed, our hydration needs increase after delivering a baby. And so if you're doing more formula, then aim for about 80 ounces of water per day as like a baseline. And this can be water, it can be milk, it can be fruit juices. It doesn't have to just be pure water itself. If you're breastfeeding, you might need closer to 96 to up to a gallon of water a day. And so while I was breastfeeding, I carried around my giant gallon water bottle everywhere I went, because I learned quickly that my nutrition was good, but if I wasn't getting enough water, then my milk supply went down significantly, especially after just a couple of days of not drinking enough. And so stay hydrated, take care of yourself. If you can't take care of yourself, how are we supposed to take care of someone else?
Great, thank you, JC. Paula, what can I do to strengthen my pelvic floor so I don't have accidents every time I sneeze?
That is a great question. Unfortunately, there is a myth out there that we need to do 10,000 Kegels a day or 1,000 Kegels a day. And there's definitely a lot more to pelvic health than doing 1,000 Kegels. And that's not even appropriate for everybody, because there are different problems that can happen from overtraining your pelvic floor. But by strengthening your abdominal muscles, by strengthening your hip muscles, all the supportive muscles that help the pelvic floor, that's going to help more with stress incontinence than just doing 1,000 Kegels. So especially if you have developed a diastasis recti, which is a separation of your abdominal muscles during your pregnancy, you need to learn how to properly engage those abdominal muscles again so that they can help support the pelvic floor. And then again, people don't necessarily, they discount the importance of your hips in helping the pelvic floor, because there's a big assistant property to the hip rotators in helping your pelvic floor strength. So I would definitely suggest doing core strengthening more than just doing 1,000 Kegels. But of course, if you are having more problems, mention it to your OB or your primary care doctor, and seek out some physical therapy, because then we can direct you to even more specific things for your individual body.
Wonderful. Dr. Holt, what tricks or tips do you have about a natural birth?
I'm going to take this question as like natural birth, meaning without anesthesia, versus a vaginal delivery versus C-section. So for women who are planning a natural birth without anesthesia, I always commend those women, because I think they're just ridiculously strong and mentally just amazing. So natural birth is a beautiful thing. That's how it was meant to be, but it's also very difficult, and it's very, the intensity of the pain is probably indescribable for women. So as far as tips and tricks, I always tell people it's always wonderful to exercise, like we've talked about before. A woman who is physically fit is going to do beautifully whenever she delivers naturally. I always tell people to be healthy and eat, a wonderful diet, a very balanced diet, again, just to kind of get ready for that marathon of labor that's about to happen. And I always tell people, different tricks and tips, like having a really good support team in your labor and delivery room, from your physician to your nurses to your husband. And there are doulas and other support people out in the community that can help during that labor experience as well. And then just really be focused. It is I do describe labor as a marathon, like I did previously. And if you are focused on a natural childbirth and are committed to that natural childbirth, then it tends to go really well. I do always tell people, though, who are contemplating a natural childbirth, to be okay if the plan doesn't work out that way. And I think that's really important. Like, people have a lot of expectations about how beautiful and how perfect it can be. And when it is, it absolutely is. But when there are unforeseeable complications, be open to your support staff encouraging to veer away from this natural childbirth plan that you have. And, you know, anesthesia is not bad and C-sections are not bad. These are safety measures that are in place for women who need them. And so always go through, you know, always plan for the best, but you have a wonderful support staff in all these hospitals if in case things don't turn out that way.
Thank you very much, Dr. Holt. Dr. McMinn, how long can postpartum stay with you, and when should I seek help?
That's a great question. I'm going to sound like a broken record, but it depends. We consider the postpartum period in general to be up to a year after giving birth, and sometimes it's even beyond that. Now, that does not mean that anybody who has postpartum depression or anxiety will experience it for a year. I always tell people that, of course, it depends on the person, and it's to be expected. The majority of women, about 80% of women, experience what's called kind of the baby blues in the first couple of days to a couple of weeks after birth. That has to do with your hormones just kind of re-regulating themselves, and it's really normal during that period to be just sort of more tearful than normal, just feel like your emotions are kind of on a roller coaster. You're also dealing with sleep deprivation often during that time, which is another complicating factor. So that's all very normal. What I tell women to maybe start considering reaching out for help or just talking to your OBGYN or someone else is if it goes beyond that first few weeks after giving birth and it feels like more days than not are a struggle, whether that's related to your mood, whether that's anxiety levels being really high, if you're having any kind of intrusive thoughts or thoughts that are just kind of hard to shake, that's when I would recommend kind of seeking help. The good news is that with any of kind of the postpartum mental health issues, whether that be depression, anxiety, OCD, psychosis, they are all very treatable, whether that's through psychotherapy, medication, or a combination of the two.
Wonderful. Dr. Zandamini, can you speak to the current rules for masks and visitors at Baylor Scott & White?
Yes, of course, and always subject to change. But currently, we still require masks, especially in the halls. There are 2 people that are allowed during the actual birth. And then they've opened all restrictions for other visitors after the birth and during the labor. And so especially, which is nice because now they do allow like siblings and things like that to be able to meet the new baby. So that's very exciting.
Great. Dr. Holt, what exercises are safe for pregnancy? Can I lift heavy weights while I'm pregnant?
I usually ask my patients what their exercise routine is prior to pregnancy. And most of the time, you can continue those same exercises during pregnancy as well. A lot of exercises are completely safe. I usually will ask my patients to modify their heavy weight lifting if they're lifting more than like 35 to 40 pounds. Oftentimes in pregnancy, you know, your body is changing, your posture is changing, your spine and your alignment are changing. And so, and in addition to that, you're limited as far as how many or what different options you have for pain control. So I always tell patients, I don't want you to lift anything heavy. I don't want you to pull a back muscle or strain something because then you're just kind of restricted to just Tylenol. But we do encourage all forms of exercise. This because again, it's going to help you in labor. I always tell patients you can't do any exercises that would that you could potentially fall. So I have patients who want to ski, and I'll tell them they can't do that during pregnancy because I don't want them to have any trauma inadvertently during pregnancy. But otherwise, most exercises are safe. I think the majority of exercises that women typically enjoy during pregnancy are yoga and walking and running. Orange Theory is kind of big in here in certain areas. So all of that is perfectly fine as long as they do it according to their current fitness level and as long as they don't necessarily overdo it with the heavy impact things.
Awesome. Dr. Zandamini, how soon after delivery can I start breastfeeding, and what are the first signs I should look out for if the latch isn't good?
So at Baylor Lake Point, we're a baby-friendly hospital, so we have certain things in place to help and to assist to make sure that if you like to breastfeed, that's something that you're able to do. So we do delayed cord clamping. So we wait about a minute before we clamp the cord, and then we cut it, and then we place baby on mom to do skin to skin. And honestly, if the baby is looking, or routing it's called, where the baby's actually looking to feed and it looks signs of hunger, then you can put the baby on the breast immediately after birth, and that's actually a really good thing. Not all babies like to do this, and some babies are just looking around and relaxed, and that's totally fine. And then we do what's called also the golden hour. So that's that first hour where you have the baby on your chest, and we typically recommend that the baby stays there. It helps with the baby and to calm the baby down, and it calms mom down as well. And so a lot of times during that first hour, the baby will show signs that it's hungry. And then after that, you keep looking for those signs. Babies aren't usually on a timeline, and so sometimes they'll do it every hour, and sometimes they'll do every 3 hours. In the beginning, I always tell patients that to not expect milk, that they're going to have what's called colostrum, which is clear. It comes out in drops, but that's all that the baby needs. And at Baylor Lake Point, we have lactation consultants, and they're really good at going in and helping with issues with latch. One of the things that I think a lot of patients don't know is that babies don't actually breastfeed by chomping their gums. What they usually do is they do a movement with their tongue, and so you need to make sure that the baby has as much as the nipple and the areola inside to make sure that it's able to do that movement. A lot of times when there's not a good latch, you'll feel a lot of pain because the baby will chomp with the gums, and that causes nipple trauma. So the lactation consultants are really good at helping with that.
That's great information, Dr. Zanamini. Dr. Holt, besides an epidural, what are other ways to manage pain while in active labor? Do you have any breathing exercises that you recommend?
You know, I don't necessarily have official breathing exercises, although I feel like the Lamaze classes out there are probably the most well-known. Generally speaking, for patients not wanting an epidural, I always tell them to move around, actively walk. A lot of our labor and delivery units, or our labor and delivery unit has wireless monitoring. If your doctor is comfortable with it, sometimes she can have intermittent monitoring where the mother gets off the monitor and just is able to walk without any kind of monitoring at all. But wireless monitoring has made it an option to get more active during labor. Our labor and delivery rooms also have showers if they want to shower. We have rocking chairs. Our hospital doesn't provide birthing balls per se. We have positioning balls, but we encourage patients to bring birthing balls that way that they can still remain active while they're in labor. And then if you wanted more options like medical options, we do have some IV pain medications that we can administer during labor as well.
That's great, thank you. JC, can you provide any suggestions for natural remedies for common issues such as indigestion, nausea, etc.?
Sure. So with indigestion, we have to kind of think about what type of things are possibly leading to that. And so we typically know that foods that are super spicy, so the spice, the grease, high concentrated sweets, caffeine, and chocolates are things that can definitely increase indigestion. And so if you notice that you're craving maybe more spicier foods, or maybe we are incorporating a little bit more of the concentrated sweets, like the like sodas or candies or chocolates or things like that, then we can definitely look there and see maybe we can make some adjustments for their eating habits. Making sure you're not eating right before laying down, and so we can kind of spread out that dinner time maybe by 2 or 3 hours prior to laying directly straight down. That will help us just to kind of help with digestion and keeping things moving through the GI tract a little bit more better. So that can definitely help too. If you're still having indigestion and you're still not seeing relief, then definitely talk with your doctor, because we want you to be comfortable. And indigestion isn't comfortable. I was always told that if you had indigestion, then that meant that your baby had a full head of hair. And I can tell you that both of my babies were bald, and I struggled with quite a bit of indigestion. So that was not expected. But so yeah, so take care of yourself in that sense. As far as nausea goes, nausea is tough because when we're nauseated, no one wants to eat. But if you'll focus on getting some type of protein, so whether it be maybe a small spoonful of peanut butter, maybe a little bit of a low-fat cheese, something that's not too heavy, not too filling. Instead of just like the cracker or a light cereal, the protein's going to sit on your stomach longer. It's going to be a little bit more satisfying to your gut, and it should help with decreasing that nausea. Also, making sure we're not going long hours without eating. Again, we want to make sure that food is full, and so maybe trying to get something small on your stomach every 3 to 4 hours. You know, listen to your body, know kind of what it means when you feel hungry, when you feel full, things like that are definitely appropriate. But if you notice that it's been several hours, 6, 7 hours since you've eaten something, that nausea definitely can occur. And then the other major one we might experience is constipation. And so constipation is no fun for anyone. And look at your fiber intake and also look at your water intake. And so during pregnancy, we are carrying a lot more than just that baby. We're developing extra fluids to help the baby get all the extra needs that it needs. We're getting extra blood, and so your fluid needs increase. And so, you know, the suggestion when we're not pregnant is about 64 ounces of water, so about 4 regular sized water bottles. During pregnancy, that increases significantly. We live in a dry climate, and then sometimes even more of a humid climate, and so you do need more water, especially if you're going to be more active. And if you are pregnant right now or about to be pregnant or just delivered, then it's going to be a hot summer. And so make sure you get plenty of water, stay hydrated, increase your fiber. Fruits, vegetables, whole grains are definitely going to be more beneficial for you.
Thank you. All right, this one is for Paula. I'm already using a pregnancy pillow. What else can I do to combat hip and back pain?
Well, as Dr. Holt mentioned already, the pregnancy changes your body mechanics a lot, changes your alignment. The weight of the baby shifts your center of gravity. So definitely strengthening your core muscles, keeping your hips flexible, mobile, doing some yoga can help. Definitely getting on a birthing ball if you have one and doing some range of motion, rocking exercises to keep that spine mobile so that it doesn't get locked into that increased lordosis that the pregnancy often brings on, can help to loosen up that area. Massage is great. Have your partner massage your lower back, get some blood flow in there. And definitely, as a lot of the other panelists said, drinking plenty of water, keeping hydrated so that those muscles don't become dehydrated, and that can sometimes lead to more pain as well. So stretching, flexibility exercises, core strengthening, and water, definitely my top recommendations there.
Thank you. This next question is for Dr. Zandamini and Dr. Holt. So we'll start with you, Dr. Zandamini, first. When is the ideal time to go to the hospital while in labor?
So I usually tell patients when they're full term that there are 4 main reasons to go to the hospital. One is contractions. So if they're having contractions at least every 5 minutes or more than an hour and they get stronger and stronger and stronger, definitely a reason to go to the hospital. Secondly, if there are water breaks, gush of fluid, puddle on the floor, all that kind of stuff. Even if they're not having contractions, I recommend that they go to the hospital to get checked out. The third thing is bleeding. So a little bit of blood mixed with mucus, we call that bloody show. That can be also the mucus plug. I wouldn't worry about that. Wait for the contractions to come closer together. But if you start bleeding like a period, that's not normal, and you go to the hospital right away. And then the fourth thing is fetal movement. So babies should be moving pretty much the normal movements. Some babies like to move more at night, some babies move more during after meals, but it should have its normal pattern. And when it doesn't, that's when you eat something, you go to a quiet room, you lay on your left side, you put your hand on your stomach, and you count how many times the baby moves. And if the baby doesn't move at least 10 times in 2 hours, then definitely to the hospital.
Dr. Holt, would you like to answer the same question? Anything you'd like to add?
Yeah, I think she said it perfectly. Those are the 4 main things that I tell my patients too. The only thing I would add is, if we are as OB-GYNs lucky enough to deliver your second and third babies, then we should already kind of know what your labor is like. But if you're with a new doctor, then and you've had any things that are outside of the norm with your first pregnancy, let's just say if you labored quickly, or if you knew like after your water broke, things were much faster and things like that. Pay attention to your first pregnancy, because it does give you some details about how your second and third pregnancies are going to be. And so you may not want to wait an hour of contractions if you labored in 30 minutes. So just use your judgment and talk to your doctor about some things that may have happened during your first delivery that can help with the second one.
Great. JC, can you tell us a little bit about some foods that may not be recommended during pregnancy, or how we should handle food cravings that we might have?
Absolutely. So during pregnancy, there are a few foods that we have to be mindful of. And the tricky thing is that when we're not pregnant, typically these foods are considered safe. But while we are pregnant, we have to remember that what we are consuming is also going to baby as well. And so the thing there with foods that are not recommended is foods that are high in mercury content. So like your fish and your seafood. Fish is a great source of omega-3, which is great for brain development. And so we do want to make sure we're consuming some, and we just don't want to have too much. And so the suggestion is to have fish about 2 to 3 times per week is typically safe for most women. Fish that are high in mercury content is going to be like your larger fish. And so it's going to be like swordfish or shark or mackerel. If you eat a lot of tuna, then albacore tuna is going to be higher in mercury than the plain tuna. It usually specifies the if it's regular tuna or albacore tuna on the can. And so being just aware of how much you're consuming and knowing that it is okay to have some, and you should have some. Other things we need to be cautious of is the risk of listeria. And so listeria is a bacteria that can develop from our cold deli meats, cold hot dogs. If you notice the meats that have like a juice that kind of gathers in the packaging, then that's kind of like an indicator that there could be listeria possibly there. It can also come from foods that are not pasteurized completely. And so if you are going to have a sandwich or if you're going to have a hot dog, make sure we're heating up the meat. We want it to be steaming hot. That can help to reduce any type of bacteria that could be there. If you go to like Subway or somewhere like that and they just toast your sandwich, that typically doesn't heat it up enough. So we really do want it to get to like a sizzling hot temperature. And then other things is making sure that we're cooking our meat all the way through. So I am a true fan of a medium rare steak, but during pregnancy, we gotta make sure that we are cooking our meat a little longer. Again, whatever we consume, baby's consuming too. And maybe your body on its own, not pregnant, can fight some of these things, but baby is a little bit more sensitive. And so if you're having eggs, cook the eggs all the way through, have either scrambled eggs, don't use the yolk though. If we're going to have if we're going to have like sushi, go with the cooked sushi. And again, just be mindful of that portion size there. And then make sure we're avoiding an alcohol. And if you are going to have alcohol, then make sure you're talking to your OB-GYN about what is considered safe. But ideally, avoiding it together is going to definitely be the better option there. And kind of in the same sense of cravings, cravings are not forbidden. We definitely want to make sure that, if you do get that craving for something sweet or something salty, then it's not that it's forbidden as long as it is safe for you and also for your baby. And so a little bit is definitely different than having a lot. And so, moderation is key. Cravings are funny. You might be craving one thing one day and then tomorrow it might be something completely different. And so give yourself some variety. Try to get a balance overall if we can. Like I kind of talked about earlier, the plate method is really helpful. But it's okay to treat yourself occasionally for sure.
Thanks for that advice. Dr. McMinn, do you have any tips for how to combat anxiety or stress when trying to get pregnant?
Sure. I think that's one of the things that people struggle with a lot when going through kind of the process of trying to conceive, especially if you're dealing with any kind of fertility issues. That just adds a whole other layer of complication. The number one thing that I talk to people about when they're in this position is just being gentle with yourself. So much of the time it can come down to, having negative self-talk, being hard on yourself. And that's just kind of adding an extra layer of suffering on top of something that's already maybe kind of painful. So doing something, sometimes we are better at kind of giving advice to others than we are taking our own advice. So even just sort of thinking about, okay, what would I tell a really good friend or a loved one if she was in this position and she was coming to me with sort of these thoughts or these emotions like I'm having? I'm guessing that you would want to be really encouraging and really gentle towards that person. So seeing if you can kind of practice that toward yourself, that positive self-talk. The other thing is making sure that you are engaging in just sort of your basic self-care needs. A lot of times our basic self-care goes to the side during times of stress. If you're balancing trying to conceive on top of just every other thing that's going on in your life, whether that's work-life balance or anything else. So making sure that you are taking that time for yourself to do the things that you enjoy, things that feel fulfilling, and things that feel relaxing. Those things look different for everybody. Everybody kind of recharges in a different way. My idea of relaxing being like laying on the couch and watching TV for a bit, maybe somebody else's nightmare, and it just makes them feel more amped up and like stressed. So figure out what works for you and what you can do to kind of help yourself, both through self-care and just self-talk.
I love all of that. Thank you, Dr. McMinn. Paula, what exercises or foods should you eat to have a healthy delivery with minimal tears or no tearing?
I'm not really sure that exercises are going to prevent you from tearing. I think a lot more of that would be position and speed of labor and delivery. But definitely staying hydrated is going to help keep your muscles more flexible. If you have a dehydrated muscle, it's going to be more likely to tear than if you have a fully hydrated muscle. Keeping yourself strong in general, doing exercises throughout pregnancy is going to decrease your risk of tearing because you're going to have just healthier muscles in general. And again, taking some of the stress off that back wall of the pelvic floor by having a stronger core so that you can possibly get into a different position where you're not putting as much stress from the weight of the baby on that back wall of the pelvic floor is going to decrease your risk. So if you are strong enough that you can get in another position to labor and push in, then that's going to give you a better chance of not tearing. Not everybody tears, but definitely having more pressure on the back wall is going to increase that risk of tearing. And so if we can labor in a little bit different position, that can decrease the risk somewhat.
Thank you. Dr. Zandamini, if your baby comes earlier than the due date, will you still be ready physically to breastfeed?
This is a very good question. Depends when. So early, so full term is considered up to 3 weeks before the due date. And that's totally normal, and many women go into labor at that time, and your body is totally equipped to be able to breastfeed at that time. Earlier than that, it's not so much that the body doesn't go through the changes that it needs to go to, it's that sometimes if babies are very premature, they end up in the NICU. And when babies are very premature and they're in the NICU, a lot of times they don't directly breastfeed. And there's something that happens that we don't truly completely understand. We know that there's a lot of hormones that go into play that emotionally increase the amount of milk that we produce, that sometimes using a pump to establish a milk supply isn't as easy as directly breastfeeding. That doesn't mean that it can't happen, and there are many women that are able to do so, but they might find it a little bit more challenging to do so. But our body is able to produce milk even with very premature babies.
Thank you. Dr. McMinn, do you want to give us some tips just about for moms that or new moms that may just have some fear or anxiety about becoming a mom?
Sure. I would say, first of all, know that those fears and anxieties are 100% normal and basically universal, especially if you're a first-time mom. This is a whole new lifestyle change. You are adjusting to not only the physical recovery that comes from giving birth, or if you've had a C-section, you're recovering from a major surgery. You're going to be sleep deprived. You're suddenly in charge of like keeping this new human alive. Like that's a lot to be taking on. So I would say one of the biggest protective factors against sort of postpartum depression and anxiety is social support, in addition to kind of the self-care pieces that I talked about earlier. So I would say absolutely rely on, whether that's your partner, whether that's parents, friends, neighbors, whoever it is. I think a lot of times as women, we're not always great at asking for help or even accepting help. But this is one of the #1 times in life where you need to be accepting of help when it's offered, or asking for help from others when you may need some extra. Keep in mind that even the people who love you and know you the best, they're not always mind readers. And so you may need to ask them, if somebody comes over and wants to see the baby, you can say like, yes, I would absolutely love that. Or if they ask, if there's anything that they can do to help, instead of saying, no, it's okay, let them know, like, hey, actually, if I could take a nap while you watch baby, that would be great. Or if it's somebody that you trust, and sort of saying, hey, actually, it would be the most helpful thing to like have a load of laundry done while I breastfeed for a minute and I'm in the other room. Use that. And again, think about what would you do as a friend for somebody else who is a new mom. Again, we're so good at giving that advice and being good friends for other people. We need to be able to do that for ourselves also.
Thank you. Dr. Holt, I had low placental growth factor in my first pregnancy. Is my second pregnancy going to be the same, because I really want to plan for another baby?
So I would talk to your doctor, and I think more details need to come about how your first pregnancy ended. But typically speaking, sometimes that particular growth factor can be associated with preeclampsia. Preeclampsia does have a risk of recurring in subsequent pregnancies. Currently, the recommended guidelines for prevention of preeclampsia, if you've had one in your first pregnancy, is to take a baby aspirin with your second pregnancy. There is, like I said, there is a risk of recurrence, but it's not always. And so I would encourage you, with the counseling from your current OBGYN, that you can still have a second pregnancy that is still safe and healthy.
Wonderful. Dr. Zandamini, can you generally talk through what are the first steps somebody should take when they think that they're pregnant?
Well, usually people do a confirmation or 7 to make sure that it's right. Usually people don't do just one. And then start making an appointment to your OBGYN to check on the baby. Usually we want to see them for their first appointment around 7 to 8 weeks. Because sometimes if the dates are not exactly right, we assume that you're that you ovulated on day 14, but that's not always so. And so if you ovulate a little bit later, if you come in too early, like around 5 weeks, we might not see anything. It causes a lot of anxiety. So, and also, like Dr. Holt said, depending on your old OB history, right? But if you're first-time mom or you've had uncomplicated pregnancies before, then I would wait at least until you're about 7 to 8 weeks to make that first appointment. Start taking a prenatal vitamin if you haven't already. If you weren't taking one, start taking one as soon as you find out that you're pregnant. And then after that, just what we had talked about before also. Start doing as healthy as possible a diet that you tolerate. Start doing maybe an exercise or walking a little bit more. And that's pretty much it. Try to wait for the time to pass because it's a long road, especially if you find out very, very early.
Great. Dr. Holt, how long should someone wait after having a miscarriage to try having another baby?
That's a good question. And I think that's going to differ from woman to woman and outcome to outcome. But in general, I usually tell my patients, if you've had a first trimester miscarriage, typically it takes your body somewhere between 4 to 6 weeks to heal from that miscarriage. And a good indicator of when you are physically ready to have, to try getting pregnant again is when you have your first normal cycle after undergoing a miscarriage. There is some bleeding that is involved after a miscarriage, and that doesn't count. Your body has to have their very first cycle, and then you know that you are physically ready. I always ask my patients to think about one more thing before trying, and that they are emotionally ready as well, because sometimes it takes longer than 4 to 6 weeks for a family to emotionally recover from their miscarriage. So we want both of those aspects of your recovery to be completed before trying again. So that's pretty much that. I always tell patients, you know, you're going to physically recover from your miscarriage pretty quickly, but then you have to ask yourself whether you are emotionally ready to do this again. So that's more important, I think.
Thank you so much. And I want to thank all of our specialists for your time today, for joining us. And I want to thank everyone for joining us on the webinar today. And we want to encourage you to learn more from our experts about nutrition, mental health, and pelvic floor health on our website at bswhealth.com/delivering-better. There's some videos from JC, Kenley, and Paula there on the website. So thank you so much for joining us today. We hope you have a wonderful day.
Bye. Thank you.